So in previous classes, we discussed about gastrointestinal tract. After that, liver, gallbladder, pancreas. So today we will discuss about urinary system radiology. Okay, we will start urinary system radiology. So basically, in the urinary system, the main organs are first is kidney. Okay, next we have this one is ureter. Okay, and after that you have urinary bladder, and after that you will get urethra. So main organ is kidney, and other will store the urine and excrete the urine. Ureter brings the waste fluid to the urinary bladder. Okay, and urinary bladder store the large amount of urine, and urethra excrete the urine from the body. Okay, so these are the important organs. So main organ is kidney. So for that, for the diseases of urinary system, kidney, ureter, urinary bladder, urethra, we need some radiological test to understand what type of disease is there and which organ is involved. So let's discuss different types of radiological scans. What will what will doctor suggest, and what are those? So let's discuss in this class. So basically, this is we will call imaging modalities. Different types of imaging modalities. Okay, modalities, imaging modalities. So first common type of scan everyone will be do, that is KUB X-ray. What do I have to do? We have to do KUB X-ray. KUB X-ray is mostly advisable for the kidney stones, urolithiasis, X-ray, KUB. KUB means kidney urinary bladder. So this is the common X-ray advisable. So whoever suffer from stones. Okay. So basically, if you see this image, we have different types of scans here. Here you have the KUB X-ray. Here you have the abdominal X-ray. Both are same. X-ray is going to click the picture of internal organ which are present inside the abdomen. So both are present in pelvic region, stomach, large intestine, kidney. Everything is present in that area. Okay. So while here X-ray you can see the differentiate. So what happened? So whenever the X-ray is to be done of KUB, the radiologist advise to take charcoal tablets. Charcoal tablets, what it will do, it will absorb the gases present inside the abdominal area, stomach, large intestine, and small intestine. So the picture of inside the pelvic region, mostly X-ray of kidney, urinary bladder, urethra, you can see here. Okay. So this is very important. Second type of scan are for to understand the urinary system problem, that is IVP. IVP. IVP stands for intravenous parallelogram. intravenous pallogram. So what it will do, we will give the IV contrast, one injection. Okay. Then after we will do X-ray. So what it will give? It will give the picture of kidney, ureter, and urinary bladder, nor urethra. For urethra, we will get another scan. So the picture of kidney, urinary bladder, and you can able to see this picture. It is not. This is kidney. You can able to see the kidney. Okay, IV contrast is given, ureter, and you can see the ureter here and urinary bladder also. But picture of clear kidney and ureter can be seen here. If you want to see urinary bladder and ureter, you will have another scan. We'll go through that. So all this pathological or disease, any condition you can see here with the help of that. Next, second, third one is the important scan for urethra, mostly urethra, urine pipe, mostly urine last ending part of kidney urinary system, that is urethra. We have to advise RGUP. RGUP stand for retrograde retrograde uretro from uretro pilogram. For P, we will get the pilogram. P is common. Okay. So what we have to do, we will visualize the urethra. Okay. What the tube carries urine from the urinary bladder. This is the end part. It is outside of the body. So there's the reason from the outside we are inserting uh the the things. Okay. To visualize the ureter. So you can see that this is the scan here. You can see that this is the ureter. This is the dye inserted. Injection is given. Okay, you can see the ureter. All the ureter here. Okay, ureter here. So like most common disease, we can see that urethral stricture. This is the right uretrograde uretrophallogram defect and hydronephrosis also. You can see that this kidney is larger than this kidney. You can see this is the normal size. This is the largest size. Okay. Next, we have another scan which is advisable for the problem of mostly urinary bladder and combination of urinary bladder and urethra. Okay, like any thickening, mucosal thickening of urinary bladder, or any cyst, anything. That is MCU. Fourth type of test radiologically is given that micturating while micturating this test is performed. Okay, micturating cysto urethro. Okay, gram MCU. Okay, you can see here this image micturating cystourethrogram MCU. Okay, for children like UTU. Okay, UTI, tract infection. You can see that this is the urinary bladder. You can visualize the urethra, urinary bladder, like bladder, urethra, any infection there. Okay, any problem while urinating. So the doctor will advise this test. Okay. So these are the important tests. Other than that, are also there. Like in the fifth, we studied that NCCT, non-contrast CT, is advisable for renal stone. renal stones. If anyone has stones, you already did the scans, so you have to advise NCCT. Okay. Next, we have sixth type of scan, that is CECT of KUB. NCCT of KUB. Okay, in that you can see the masses, any mass is there, infection is there, any mucosal thickening is there, because in that you are giving IV contrast. Okay, so this is for any type of infection, any type of masses, cyst, tumor, fibroid, cancer, all type of diseases can be discovered with the help of this scan. Next, we have another type of scan, that is already you discussed CCT. Other than CTCT, you have CCT, plain CT urography. Okay, for visualization of all the tracts, mostly tracts, ureter, urethra. Okay, so basic depend upon the patient condition, depend upon the patient financial condition. We have to advise the scan. Okay, X-ray also doing the same thing, but CT have more visualization, depth visualization. X-ray will give the superficial visualization. Okay, visualization. Okay, this is the thing we have to explain the patient why you are doing same test. You are advising X-ray as well as CT. So we have to explain the condition to the patient. Not we are not necessary. You have to advise. Unnecessary, you cannot advise the patient. If it is required, then only you have to advise the patient. Okay, it is very important thing we have to remember. Next, eighth test type of scan is MR urography. Like MRI scan, we have MRI urography. Means in that you will able to visualize small tissues, tissue levels like nephrons. In the all the scans, there is not availability of any type of structures are available. But if you want to go deeper inside the tissue, okay, you have to advise MRI of KUB, kidney urinary bladder. And this is the important thing. Next type of scan which is advisable in urinary system, that is most common ultrasonography. Most of the person go to the doctor and advise he will advise to take ultrasonography where he found stones, cyst, anything. But actual size, actual place, if you want to see, CT abdomen or NCCT is more preferable than USG. Okay. So this is the thing we have to know about that. So all these are different types of scans are advisable. It is also advisable by the urologist also. Okay, urologist also advise this type of scans. So if a patient come to your clinic with the problem of unable to do the urination, what you will do? Which type of scan you will advise? Anyone, please? Sir, tell me. If a,
RGUP,
if a person first cause
first
reason.
KUB, sir. First KUB.
Okay. Then,
And if not clear, then RGUB. Because urethra, want to see.
okay, okay. So first, we can go through the simple scan, simple X-ray KUB, or else we have another option, that is ultrasonography. So we have to remember that first investigation of choice of soft tissues, abdominal pain. Okay. it is advisable to go through ultrasonography. So if there's uh, urinary bladder is soft tissue, kidney is soft tissue, everything has soft tissues. So we can go through X-ray, KUB, or else ultrasonography.
USG.
Then afterward, we have to advise if it is a problem of urethra, go through RGUP. If a problem of ureter or kidney, IVP. If it is a problem of urinary bladder or urethra, you can go through MCU. After that, if it is calculated that this problem is the blockage is there, so no, if it is coming under this conditions, okay, it is okay. If it not, then we have to go through a CCT or any infection, fever, we have to go through CCT, or else MRI also required in some conditions. Okay, this is how we can approach the disease while seeing the patient condition. Okay, understood, sir?